Hey guys, I'm Sebastian at Performance Play Sports Care. We're the locally world famous chiropractors in Costa Mesa, California. We're going to cover and create on YouTube a groin pain question playlist. Okay, so this is one video of a larger playlist that we have lots of questions answered. Questions were derived from questions that you've asked us, questions you've asked on forums that we've investigated, as well as other questions you might have asked on Google. These are really, really common questions, so please subscribe to the channel and check out all of the videos as they come out. The playlist will keep getting bigger and bigger, okay? So at any point in time, we have timestamps in these videos that I'm providing that are at the start of each question. So if at any point, if you need to jump back and forth, you can always use that feature as well. I have all the questions on here. We're gonna do 3 questions today. And I'm going to answer them to the best of my ability, okay, based on what I know now. How do I know if my groin pain is serious? How do you relieve groin pain? What is the most common cause of groin pain? So the first one we're going to start with is, how do I know if my groin pain is serious? Well, I think it depends what you mean by serious, to be honest with you. Are you talking about serious like as in life-threatening? Well, in that case, you should probably have a full medical evaluation. I know it's not the question everybody wants to hear, but realistically, come on, guys. Like, as an adult, you need to have a professional look at your hip to deem that it's not anything life-threatening. There are some scary things, some sinister pathology that can occur within hip joints or hip groin regions. By the way, the area that I'm talking about today is we're talking about kind of right in here mainly. Some people will feel stuff into here as well, but mainly we're talking about kind of this area. So there are things that can happen in there, especially in younger individuals, generally like kids under the age of 14 that have some type of hip pain or some phantom knee pain, and there's no real big reason for it. They should be evaluated pretty aggressively. There's things like fractures, and there's slip femoral capital epiphysis. There's a couple odd conditions that people can have in there. Also, in older age individuals, you never know when there's things like cancers and tumors and infections and so on. Like, those are all things that could be a reality. However, if you're talking about seriousness as in will it maim your hip and disable your hip, most of the time people suffering with groin pain do not necessarily have long-term disability from it. It does hurt, and a lot of times people have trouble getting up out of chairs, sitting for too long, walking, crossing their legs and running. Like, they certainly have problems with it, but it's not necessarily anything that will create long-term disability. However, the longer you have it, there are things like arthritic change that can happen within the hip. If you're a younger individual and you have something that is ongoing, the theory is the area of the body, such as the hip, that is trying to help out and stabilize possibly a relatively unstable area or an area that's had some trauma, then there is a possibility of a growth of bony changes in the area, which is hard to address over the long term. I think we all know that somebody in our life that has had something like a hip replacement before. There are, in some of the weight-bearing joints, there are bony changes that can happen over the course of time due to trauma or lack of use or overuse that can create the bony changes. Once you get to a certain point, there's nothing rehab-wise we can do to help out to change those bony changes back. That might be a case for a hip replacement, all right? But if that's what you're talking about with serious, I hope that answers the questions with that. That's a little bit of an obscure question, because I would normally ask a second question, like, what do you mean by serious? And then we talk about the concerns. By the way, at any point in time, if you want help from us, we do virtual or in-person services, and we actually have some helpful stuff at the bottom in the description. There's a bunch of links in there with free resources and so on that you guys can take advantage of. How do you relieve groin pain? Well, so this question is one that we've covered a couple times in our normal videos on YouTube. We've given some rehab exercises that work really well. We've given some other things like some skin rolling developed by Justin Dean and Philip Snell. And so the easiest way to address it typically is find the position that bothers you. A lot of times people with groin pain, say on this side, doing something like this bothers them, squatting bothers them, and then sitting bothers them. And so these are all hip flexed positions. And sometimes the easiest thing is just to supply some hip extension. A lot of times when people do this, they tend to not really have any problems or negative experience with it. I'm sure a lot of you have already tried hip flexor stretches before. The fact of the matter is they a lot of times do work, but people don't use the amount of volume that they need to. They only do about 10 times a day, when in reality you should do quite a bit more. This ground is fairly hard for my knee, so I'm going to have to do it a little bit like haphazard. But usually we have people step out a little bit with the other foot and just rock their hip pocket down to their foot. You notice the rest of my spine is not really going anywhere. We don't want to see this kind of stuff. And so you go here, and then maybe a little bit of a reach up. And this is kind of the stretch that we have people do. And we have to do it in pretty high frequency. I know that when I had some groin issues, I was at a diner one time, and to sit with my hip flexed was just completely unbearable. And so I just sit on the outside part of the actual diner booth, and I put my leg back, and that felt so much better. And so a lot of times just finding the position that creates the problem or aggravates the pain or the groin area, if you just do the opposite for quite a bit, actually surprisingly it works very well. I know it's a very simple way of looking at things, but realistically speaking, sometimes the body's just looking for some neutrality. It's looking for, if you do a bunch of flexing of your hip, maybe it wants the other part and it wants to meet in the middle somewhere. All right, there's magic in the middle, I assure you that. The third question we have is, what's the most common cause of groin pain? Hip pain in the front, I'd probably say it's hip impingement. I don't think a lot of people end up having labral tears. In older populations, there is arthritic findings or bony changes that can create the impingement in that front part. But labral tears are an interesting one because it's the one that most people are really afraid of. I'm sure there's been a lot of writings on the internet and videos that scare people of labral tears, but realistically speaking, small grade labral tears can be managed actually with conservative care. It's not necessarily a smoking gun for needing surgery. You can manage it without really having to have surgery at all, and we've seen quite a few of them in here too. Obviously, it's dependent upon the activity level in the sport or things that you want to do in life. Like if you want to be a gymnast, it's a little bit harder to manage a case like that than it is someone who just generally wants to walk and run. There are a little bit different scenarios, different requirements that we're asking of the body and the hip as well. But commonly people have hip impingement. The interesting thing with hip impingement though is that some people, what we have, it's not really a diagnostic category, but it is observed pretty frequently, is I call it dynamic hip impingement. And let's just say if I have hip impingement or a groin pain right here, right now as I sit here, sometimes something simple like taking your hands on your side of your belly and pushing your guts into your fingers outward, all of a sudden reduces pain pretty quickly for people. It's literally like that sometimes. So pulsing into the fingers with the guts, it creates centralized pressure within the core area, and it helps out to deload an aspect of what we call the acetabular rim onto the femoral head or neck. And so it deloads the joint a little bit by providing some central stabilization. Usually a rehabilitation approach with groin pain is pretty, I don't want to say it's pretty standard. It's really important the way it's coached, but generally most good rehabilitation places will incorporate some form of exercise starting from the center outward. So you need central stability to create distal mobility. And so this is based upon some of Gray Cook's work where you're creating some core stiffness before you actually explore too much of hip range of motion that you're trying to acquire back. And not that you can't do this at the same time. Something like a bird dog exercise is a really good way to create core stiffness while you extend the hip, because hip extension might be the thing that's really helpful to you. And after that, we can do something like a goblet squat, which if you have the weight in front, or if you have two weights, then the stabilization here will create stabilization here, and it'll make it so you can go into hip flexion without any problem too. I had a couple cases this last week where we actually did goblet squatting on day one for people that had pain with squatting. So you can accelerate the process pretty quickly if you want to. Now, if you guys want help with this at any, just contact us below, all right? We do offer virtual in-person services. We're very good at conducting things virtually. And as you see by some of the videos, we just customize them just to you, all right? We just have you do it on the video. But there are people probably in your area who can help, but it's going to take some questioning to figure out if they're quality for you or not. All right. We'd love to help you guys take advantage of the free resources we have, and go onto our YouTube channel, subscribe, and then look at the remainder of this playlist. All right. We have a lot of questions that people ask, and if they're barriers for your understanding of how to get better and what to do to get better, then you need to learn a little bit more. All right. We're here to help. We'll see you guys next time.